you, Dr. Manish and Sahani sir. Good evening, good afternoon, and good morning. This is the 1405th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to the session, and today our guest is Dr. Partha Chakraborty from Malaysia. Let us begin the session. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day from 7 to 8, the Hindi session, 8 to 9, the international session in English, and 9 to 10, a local language session in Malayalam. And we have participants from 65 countries already in this webinar sessions. Doctors as well as eminent personalities have presented various papers in this forum. And as you all know, today our guest is Professor Dr. Partha Chakraborty. Doctor hails from India and now practicing in both in India and Malaysia. And doctor has completed MD Homeopathy and then B.Sc and then FSS and FF Home. These are the medical graduate degrees Dr. holds, and formerly associated with the Lincoln University College of Malaysia. Currently pursuing online courses on medical neuroscience under Duke University, and he was the associate professor, Department of Homeopathy, Lincoln University College, Malaysia. He is a winner of FF International Award and MD Homeopathy over 26 years of experience, and a person who undertook research activity, writing, teaching on medical subjects, and currently working as a homeopathic doctor, providing physical checkup, diagnosis, advising patients regarding necessary investigations, and installing requisite treatments, and providing with healthcare system. He has an experience of managing 2 lakh cases in his clinic over the practicing years, and he has written a lot of articles. He is a visiting professor at BHMS Malaysia, visiting homeopathy clinic in Kuala Lumpur, Malaysia, patient care, medical data, interesting medical advice to training staff, students, clinical research, writing, or so many things about him. And he has the teaching and the subject of homeopathy to the students and doctors. So many things we have to say about doctor. All those things were written in our posters, so I'm not going to elaborate all those things. That will take more time. Anyway, Dr. Partha Chakraborty has presented more than 6 papers in this forum. All the papers were really excellent. And he has contributed 4 papers on brain tumor session. And today, the subject of discussion will be entirely different. A dying case regenerated by homeopathy. As you all know, there are cases supposed to go to the heaven, but with the help of homeopathy, you can bring back to the home and the patient can live happily. This is what Dr. Partha Chakraborty sir is about to discuss. Welcome. We proudly welcome you, sir.
Yeah, good evening. Am I audible, Dr. Danish?
Yes, sir.
Okay.
So, Dr. Partha, you are here. Glad to see your face today.
Sorry?
Yes.
I'm Dr. Sani speaking, sir.
Yes, sir. Good evening, sir.
Good evening. Nice
thank
to see
you,
your
sir.
face again and again. Carry on, sir.
Thank you, sir.
Carry on.
I need your blessings always, sir.
Carry on, sir.
Okay, sir. Can you see the full screen?
Yes, yes, sir.
So actually, I've been practicing for nearly 3 decades over here. Over here and in Malaysia, Dr. Dhanesh has introduced myself. So in my entire practicing career, we are actually specialists of chronic cases, definitely. But in our journey, in our clinical practice journey, everybody of us, not only myself, everybody of us definitely have faced many acute cases, many serious cases, and it has been no exception for me also. I've been treating a lot of serious cases in my clinic, and one of the cases that I treated in 2023, the end of 2023, was a complicated case. It was a complicated pathological case. It was mostly a cardiac case associated with brain stroke, and there was hypertension. A lot of pathologies were involved with that case. So I actually video recorded that case. I had that case with me. So I thought that I must present this case. It can be something slightly different. So let me start it. So in our practice, as I told you very recently, that I have been seeing a lot of cases, including very serious ones, brain tumor patients, cancer of the colon, cancer of the stomach, cancer of the rectum. These sort of cases are definitely coming to us. We are seeing every day, almost every day, acute pain in the knee. There's a huge swelling in the knee. These cases are coming. Cardiac cases, according to at least in my practice, I've seen cardiac cases are very rare. They're very rarely coming to us, at least to me. Maybe because we are having very good cardiac care hospitals in our place over here. So I happened to see one very serious cardiac case in 2023. So today's discussion will be regarding that very serious case, which was I thought that this will not survive more than 7 days. In fact, I did not want to take up the case, but after the insistence of the son that please take the case, whatever be the outcome. We know that my father is dead. The son was telling me, but still you try at least, because the hospitals, the mission hospital over here in Durgapur, the Health World Hospital over here in Durgapur, they're all super specialty hospitals. They actually refused to take this patient because they told that this patient has nothing to we have nothing to do in this patient. He's going to die, so take him to. So in this condition, that patient was brought to me, and that emergency case, which was destined to die within 7 to 10 days, survived for more than 1 year actually. Now, emergency is mostly an unfortunate and unexpected occurrence. You don't know why, when it will happen. You can fall down, you can break your leg. That's an emergency. I've seen a emergency case in my clinic, another cardiac case, another brain stroke case associated with cardiac complications, dying in front of me. He came to my clinic is just with some pain in the chest. Suddenly it increased and he died within 1 hour. I've seen these cases in my clinic. So emergencies, you cannot predict when it is going to happen, when it's going to come. But it comes, and it definitely, we get some scope in our clinical practice to see these cases. And these are the actual learnings, how to manage these cases. How do we act in these cases? So they are catastrophic cases. They are very dangerous cases to handle. So according to Dr. Borland, I follow, some of the English homeopaths very diligently. Of them, one doctor is Dr. Douglas Borland. I have referred his name very often in my lectures to my students, Dr. Douglas Borland. He has got a very nice book. I can refer to you that book. Those who have read, it's very fine. Those who haven't read, please go through that book. Some Emergencies in Clinical Practice by Dr. Douglas Borland. Very small book, but it's a very informative book, very good book, very methodical book. Over there, he has discussed about emergencies, because regarding emergencies, we don't find so many papers in our journals, in our books. We mostly deal with the chronic cases. You open a homeopathic book, you'll find that chronic cases are being discussed. But emergency cases, which are actually, which are very stressful, which require a lot of courage to handle. These cases, this discussion regarding emergency cases are very rarely discussed in literature. At least I have not seen so much. Dr. Douglas Borland has mentioned, and I mentioned actually from his reference, these two criteria, that emergency cases can be divided broadly into two portions. One, where the patient is suffering from a medical problem. and suddenly he has got a sudden acute crisis in his life. Say, for example, a patient is suffering from type 2 diabetes mellitus. Suddenly his blood sugar level falls and he goes into a hypoglycemic coma. That's an emergency. That's a very serious condition, emergency. Say, for example, a brain tumor patient. You know, you are treating a brain tumor patient, and suddenly there's an exacerbation of the headache. Suddenly there's an exacerbation of the vomiting. He starts vomiting. So immediately you have to control that vomiting, otherwise the patient will die of dehydration. So these sort of emergencies definitely happen. And when you are seeing serious cases like brain tumor, diabetes, other cases, you will have to deal with these cases also. Very recently, just 2 days back, one small child was brought to me, just 7 months old, an infant was brought to me. She was suffering from hyperpyrexia for the last 5 or 6 days. They were giving paracetamol. They went to a local homeopath in Asansol. They were staying in Asansol near here. They went to a local homeopath. He gave some remedies, some combined medicines. Still, the fever was not coming down. And then that baby was brought to me. That is an emergency. The fever is shooting up to 102 plus degrees Celsius. And that case was solved by simply, rusters. So this sort of acute crisis, when you are seeing these cases, I will present this baby's case one day, because this baby is a very special patient for me, because her parents were suffering from primary infertility for the last 12 years after marriage. And this baby came after homeopathic treatment. That was case of primary infertility. I will present that case some other day if I get the scope. So this baby was having sudden fever, and it was well managed with Rustux. So this is one sort of emergency we are facing. Another type of emergency that we are facing in our clinics is a great pain. Very often we find pain in the abdomen. Patients are coming with pain in the abdomen, and we can diagnose the patients whether they are suffering from cholecystitis or cholelithiasis, or even renal nephrolithiasis, renal calculus. So these sort of cases are coming. We have to handle the cases. My request to everybody is that we are having very good medicines for handling these cases. Please do not refer the cases on the first hand to the hospitals. Okay. And these cases, why we should take up these cases? Because these cases help us in building our confidence. It helps us in overcoming our nervousness in seeing patients. Because these emergency cases are very, make a beginner very nervous. But as you grow with your experience, as you deal with these cases, you become more confident. And with over the passing days, as you manage these cases, you increase your risk-taking ability. Now coming to the case details. This patient was brought to me on 28th of November 2022. It was winter time. 28th of November 2022. He was brought to me in my clinic by his son in a very serious condition. He could not walk properly. He was aided by his son, and as I told you, he was refused admission in the hospital because his condition was very serious. The cardiologist over there told that he's not going to survive. So please take him home. So that in that condition, he was brought to my clinic. Now, I am very grateful to the patients that I have been allowed to record the cases so that I can show these cases to my students. And fortunately, I have been showing this case to the learned doctors over here. So just notice how the patient enters my clinic. I'm writing the video.
এটা আসলে আমার পুরো ছিল না। ডাক্তারবাবু বাইরে পাঠান।
See how it's stepping.
মানে একা হাঁটতে পারবেন না? ও ছেড়ে দিলে পড়ে যাচ্ছে না?
My husband is asking, can he walk alone? The son said, no. If I allow him to walk, he will fall down. And just listen carefully. He is having some hiccup. Listen carefully.
ধীরে ধীরে আমি নিজেই পড়ে যাচ্ছি।
So some of you have noticed that he was having hiccups. Now, these hiccups are very, just like this, just like this. These hiccups are very bad signs in these cases. If a case of renal failure comes to you with hiccups, you can say that this patient is not going to survive. This patient was a cardiac patient and was having a lot of hiccups. So this is the way he entered my clinic. 64 years, male patient, 64 years. This was a small summary. I got a very quick case taking, suffering from pain in the chest, and he was having shortness of breath when walking. On exertion, that's very common in cardiac cases, that the patient on exertion will be having some shortness of breath, some dyspnea, and he was continuously having continuous hiccup, and sometimes some death rattle. What is a death rattle? That's a very bad sign. Again, once again, I tell you, just like this, just like this. That means he cannot inhale a lot of, required oxygen. So suddenly he starts inhaling or exhaling carbon dioxide. So this sort of hiccups associated with the death rattle is not at all a very good sign. We have seen many cases in NIH hospital when I was a student in NIH hospital. Very serious cases used to come over there. Over there, when we used to see these hiccups and death rattles, our teachers used to teach us that this patient is not going to survive. So these are some of the very bad signs whereby you can fix up a prognosis. And he was having acute fever. Maybe he was having some infection and he was having some fever. And there was total confusion in the patient. There was total confusion in the patient. He could not recognize people. I will show you in the video. Even he could not recognize his own son. He could not recognize. When I asked, who is sitting beside you? He just looked at his son like this, but could not recognize. So there was total confusion. And when I asked him the question, I will show you the video. When I asked him the question, what happened? What happened to you? What is your problem? He was just, simply just moving his hands and telling something, weird. So this is nothing but delusion. He was suffering from some sort of delusion, answering irrelevantly. He was having a history of hypertension and having a comorbidity of osteoarthritis of the knees. There was associated flatulence and bloating of the abdomen also. These are all associated complaints. And when I started examining the patient, I could find that the skin was very cold to touch. It might be due to the cardiac problem. It might be due to the weather condition because it was already winter season. The appearance was pale, pulse was thready, fast, and sometimes it was irregular. And cardiovascular system, when I put the stethoscope, there was a lot of murmurs all over the chest. There was a lot of murmurs. There were the irregular heartbeats. These are all the findings in this case. Now, the son gave me the ECG. You can find the ECG was done on 24th of November 2022, just 4 days before coming to me. See the pathologies found in the ECG. Left atrium dilated. Eccentric left ventricular hypertrophy. This left ventricular hypertrophy is found in long-standing hypertension cases. When a patient is suffering from long-standing hypertension, you will obviously find left ventricular hypertrophy. There was evidence of degenerative valvular heart disease. All the valves were degenerated. They were actually getting degenerated. Severe aortic stenosis. The aorta was stenosed. The blood could not come out of the heart properly into the general circulation, systemic circulation. There was moderate aortic regurgitation. And there was severe mitral regurgitation and severe left ventricular systolic dysfunction. Lot of pathology. The valves are involved, aorta is involved, the mitral valve is involved, blood ventricle is involved. All the areas of the heart is involved in this case. So the ECG findings, you can definitely see from the ECG findings that the patient is going towards a heart failure. It's a in-swing case of heart failure or cardiac failure. Now this is another video. Just see the video. The audio is not clear. Just keeping the hand like this. Okay, you find in baptisia, you find that the hand is like this, doing these motions. Same thing you find over here. And when I asked what is happening, he's saying nothing is correct, nothing is correct, just like this. Could not describe his problems, presented vague complaints. Now, at this point, I asked, who is sitting beside you? He looked at his son, could not recognize his son. Total confusion. So, in this case, you can find from the ECG findings that this was a case of imminent cardiac failure, heart failure, where the heart is going to fail. And the most notable symptom, which was very interesting from our point of view, was confusion and delusion. These two things would not have been noticed by the allopathic physicians. They would have rushed for the ECG findings. But homeopathic teaching, homeopathic mode of case taking, homeopathic mode of management of patients is slightly different. We are slightly, I feel we are slightly advanced than the allopathic physicians. Where they end, we start from there actually. So we have now we have noticed that there are two things very prominently present. Pain in chest is very common. Shortness of breath is very common over here. But now we see that the patient is having confusion and delusion, which is very, very prominent in this case. So prognosis, not favorable. Prognosis is unfavorable. If you go through Kent's 12 observations, you will definitely come to the conclusion that the prognosis in this case was not favorable. So my sincere advice to everybody, those who are practicing, those who are junior to me, in these sort of cases, just tell the patient frankly that this case is not favorable. Do not expect much from me. I will try my best. So primary goal in this case, in every case I set a primary goal. This primary goal in this case was we have to perceive what is to be cured in this case. Number one, this is Hahnemann's golden words. What is to be cured in this case? We have to perceive, to initiate some life-saving measurements so that the patient can survive, and to improve the cardiac complications, including increase of ejection fraction. This ejection fraction is very important. If you go for an echocardiography, you will find that the cardiologists are mentioning ejection fraction. EF is this amount. So EF, if it falls below, 35, 30, that's a very serious condition. So I don't remember what was the ejection fraction in this case, but definitely the ejection fraction in this case was definitely below 30, according to my experience. I have seen many cases of cardiac complications. So ejection fraction has to be increased. If ejection fraction is increased, then there is a slight chance of survival of the patient. My first prescription in this case was Carbovage. Carbovage 6 in these cases, there is a controversy among some people of us. Some recommend go for low potencies and some recommend high potencies. Okay. Dr. Douglas Borland, whom I am a big follower, fan, he prescribes high potencies always. If you go through Dr. Borland's writings, if you go through Dr. Maganlal Desai's book, Coma, if you go through Dr. Sarabhai Kapadia's book, you will find that they are all prescribing high potencies. They give high potencies in repeated doses, frequent doses in these cases. Then these cases will, come back to the normal or near normal at least. But I didn't have that so much of courage to give 1 in this case, so I gave Carbovage 6. And why did I give Adonis vernalis? There are a lot of mother tinctures that are coming in our cardiac practice. We are having Crataegus, we are having Adonis vernalis, we are having this NASA, we are having Laurocerasus, digitalis, all of medicines. Adonis vernalis, I have found that it has got an active principle that is called adonidine. There's an active principle in Adonis vernalis which is known as adonidine, and adonidine has a capacity to increase the ejection fraction. So if you can improve the ejection fraction, there is a probability that the patient might survive. So that was the reason that Carbovage 6 was given along with Adonis vernalis mother tincture. So this was given on the date was, I think, 28th of November. Next, after 7 days, After prescribing, I was not at all confident that this patient is going to come back. But to my utter surprise, on 7th of December, almost a week after, the son came along and told my father is better. My father is better, but he is slightly weak, very weak, is unable to walk. So I have come alone. He's bedridden, but he's better. His shortness of breath is less. All in all way, he's eating, he's passing stool, he's passing urine. So in that way, he's better. So he's better with carbovate 6 and Adronis 1 of course. I repeated carbovate 6 once again. Okay. Why did I repeat carbovate 6? Because there might be a controversy over here. Because we learned from our classical teachings that once the patient starts improving, it is advised that do not repeat the medicines. But I have uh, I have read Dr. Borland's book repeatedly, where he has written that in these serious cases, when the patient starts improving, you can find in his writings, when the patient starts improving in that reactive phase, don't wean off the medicine. At least continue the medicine or continue some other medicine which will support the main medicine. So that was the reason why I continued with carbovate 6 and atomase vulnerabilis. And as because he was having some delusion and confusion, I asked the son to go for a CT scan of the brain because the patient family was slightly poor. They could not afford an MRI. So I asked them to go for a CT scan because I suspected that there was some brain problem also. And blood examination was also advised. The CT scan of the CT scan of the brain and the blood test was advised to rule any other associated pathology because these pathologies are very important for our prescribing purpose. Next report, the son again came alone on 19th of December 2022. Son reported patient is better. Hiccup has reduced. This is a very important achievement with carbovate. That hiccup has reduced, that means the patient is improving. And he can walk within the house with some support, with the support of other family members, he can walk. That means his breathlessness, his shortness of breath is slightly less. Appetite is better. So hiccup is less, appetite is better, can move with the support of others. These are all, favorable signs. So we have seen some bright sunlight that the patient might survive. CT scan of the brain was done on 15th of December and blood report it was brought. There were acute infarcts at the cerebral hemisphere. The cerebral hemisphere had a lot of acute infarcts. So there were some strokes. There were some minor strokes that were happening in that patient, maybe due to the hypertension or anything else. There was age-related cortical atrophy. Though the patient was around 64 only, but he had got a cortical atrophy, which is very common in aged people. The cortex gets shrunk. Blood creatinine was normal because creatinine should have been done because normally in these cases we find that the creatinine levels goes up and the kidney also starts failing. So creatinine was normal and the interesting finding was that sodium was diminished. So now the picture is clear. The confusion was due to lack of sodium. So this was a case of final diagnosis was like this: impending heart failure with hyponatremia and brain stroke due to any other pathology. Now, when these things are all combined together, now you can form a prognosis that the prognosis is not at all good, worse. So you are dealing with a very serious case. You are dealing with a case which is improving right now, but it can succumb to the pathology at any moment. So don't give any, assurance to the patient. I told the son that we are not out of danger. You don't have nothing to be enjoyed. We have to move, further. Now because of this brain stroke, the dilution, these things, I changed the remedy. So actually carbovate acute symptoms were less now. Now I started Arnica montana, and in these cases normally I give very low potency, 3 potency, Arnica montana 3, and Adonis Vernis was continued, mother tincture. Next visit was on 2nd of February 2023. Now, this after that date in November, the patient came to me on this date. Now you just see how the patient is rising from the chair, how he's walking. Remember the first video and now the video. Next video, see. He's walking like a normal man. Getting up from the chair. And his, talk, his speech is normal. He asked me, can I go? I told, yes, he can go. So the developments in this case so far, if we make a synopsis of the case right now, February 2023, there was vast improvement in the patient. Patient walks on his own. There was very less confusion while talking, while speaking, while narrating his own complaints, and there was no shortness of breath. He was walking quite better. 18th of February, again, he came to me. In between, he had got a bout of breathlessness. I told you that these cases can, succumb to, bad conditions at any moment. You cannot tell when it will be. So suddenly he had got a sudden breathlessness. There was weakness of the right side because he is having some stroke problems. So he was having slightly hemiplegic symptoms and he was hospitalized for oxygenation. He was having lack of oxygen. So he was hospitalized for some hours, took some oxygen, and then he came. After that, he came to my clinic. This was a video. I asked, what has happened to you? He's telling that I'm having some shortness of breath. Yeah, I'm having numbness of these areas. Having cramping pain in the abdomen. So he's summarizing 3 points: shortness of breath, hemiplegic symptoms, numbness of the hands, and cramping in the abdomen. And another thing he told that I'm forgetting everything. I can remember. I asked him, please walk and show me how you are walking. I asked, are you having any problem in walking? He told no. But understanding commands is slightly, difficult. When I asked him, turn around, he couldn't understand in the first phase. So understanding commands is slightly bad. Now I gave arsenicum album because he was complaining of the main complaint that he told me was shortness of breath and having some breathing problem. So I gave arsenicum album. Arsenicum album, remember, is a very good emergency drug for cardiac complications. Next visit, 25th of April. So he was better. He was continuing with arsenic and adonis. He was better. This was the video on 25th of April. He's entering my clinic. Now he's telling that for the last 3 days, I'm not feeling well. I'm having general weakness, drowsiness, and he's having pain. Drowsiness, Always wants to lie down. Pain in the right side. Pain and weakness in the right side. Right side. Right side. Always feeling drowsy.
জল পিপাসা কেমন লাগছে? খুব কম লাগছে।
Thirst, I asked thirst. He said less.
ঘুমিয়ে পড়ছে না, এরকম হচ্ছে? ঘরটা খুব গরম নাকি? যেখানে থাকেও না, হ্যাঁ খুব গরম। মানে ঘরটা কিসের? ঢালাই আছে।
See, it's April month, 25th of April, almost end of April. So by the end of April, it is very hot over here in our place. So he's having this, the atmosphere is hot. He's having drowsiness. He's having thirstlessness, having weakness in the pain in the limbs. So obviously, the next prescription will be gelsemium. Next prescription was gelsemium, and I started and I continued with Adonis 1. I kept my faith on Adonis. Gelsemium 200. Because the patient has become, the vital force is better, so I increase the potency. The date is wrong actually, it will be April. Now, that was almost the last visit of the patient. He started coming to me in November 2022, and the last visit was on 25th of April. Patient was reportedly leading a normal life because after 25th of April, the patient's son came to me. He took medicines for around 1 or 2 months. And after that, suddenly there was no reporting after September 23. The patient was totally, and this happens in our practice that when the patient remains well, they don't report any further to your clinic, they don't come. And either you do not get any information regarding these patients, or if any patient is referred by these patients, then you can get information. Now, this patient is unfortunately no more in the world today. He has expired in maybe in 23, end of 23. How do I know? Because in 2023, I think in November or December, his son came to me for his own personal treatment. And out of my curiosity, I asked, what about your father? He told them, my father was very good. He was well. He was well. But after the Durga Puja, that means after October 2023, suddenly he had some slightly shortness of breath, and our neighbors and we rushed him to the hospital. And from there, he started taking allopathic medicines. They were planning to take him take him back to me, but he started allopathic medicines and he couldn't survive for more than a couple of months. So he expired in end of 23 or early 24, like that. Anyway, the learning from this case, what I learned from this case is that these acute cases, these emergency cases can be dealt with our homeopathic medicines when they are actually refused by the super specialty hospitals, that no, we have nothing to do in these cases. We cannot operate on this case. Our medicines are not going to help you any further. So you take back this patient to your home. So at least from November to at least for 1 year, this serious case, which was going to die within 7 days, that patient survived with the help of homeopathy. That is the beauty of homeopathy. So this is the conclusion, that homeopathic medicines reversed a case from the jaws of death. Brief summary, I just mentioned summary. I'll just take another 5 minutes, not more than that, Dr. Dinesh. So once again, I refer to Dr. Douglas Borland. Please go through his book. He's a very learned man, English physician, very good writings. So from his writings, he has mentioned 3 types of cardiac cases that we see in our practice. One is cases with acute cardiac failure. The second type is cases with gradual cardiac failure with tendency to dilatation of the, of the chambers of the heart, the atrium, the ventricles, and cases of acute cardiac attack, that is angina attack, angina pain. These are the 3 general types that he has, classified the cardiac cases that are coming to our practice. So I mentioned over here, very interesting. And the DD, differential diagnosis of drugs in cardiac cases that are normally coming. In acute cardiac failure, Dr. Borland has mentioned about 4 drugs. One is arsenicum album, where you know there will be a lot of anxiety, lot of thirst, lot of restlessness. Carbovage, where you will find that the patient is, you will find a picture of collapse. The patient might collapse, might die at any moment. The skin is cold, there will be a lot of air hunger. The patient will not tolerate any covers. Arsenic is just a different. Arsenic will feel cold, he will be chilly, he will be taking some covers. Carbovage will throw up the covers, he will ask the AC to be put on. Antimptert is just like, arsenic, but there will be coated tongue and there will be some, cough, some respiratory complications also will be there with our antimptert. But the restlessness of arsenic will not be there in antimptert. Rather there will be a lot of prostration, weakness in antimptert. These are the differentiating point. Oxalic acid is very rarely required, but in some cases where there is numbness of the extremities associated with the cardiac complications, you can think of oxalic acid. And interestingly, oxalic acid patients, they will tell you that when I think of the complaints increase. That's a very peculiar symptom of oxalic acid. So these are the 4 drugs that Dr. Borland has mentioned in his book. I have mentioned over here. And other drugs which can come for cardiac failure, they are NASA, which is mostly for, for angina pains or where the heart is damaged by infection. Naja can come. Lachesis in cases of climacteric cardiac ailments. Strophanthus, where strophanthus is a very interesting drug where the heart is very weak. If you have to support the heart with some medicine, strophanthus is a very good drug. It actually strengthens the myocardium, the muscles of the heart. Thereby, what happens, the stasis is relieved. When the heart cannot pump properly, if you give strophanthus, the muscles get, powerful. They pump the blood, and the blood gets circulated in a better way in the systemic circulation. Thereby reducing the peripheral edema, cardiac edema. So strophanthus is a very good drug. Lycopus. Lycopus is a drug where you will find 3 pathologies: cardiac ailments, thyrotoxicosis or thyroid problem associated with bleeding hemorrhoids. When you get these combinations, you can think of Lycopus. Adonis, I told that Adonis, if you go through Boric, if you go through class mathematics, you will find all sorts of cardiac pathology is there in Adonis vulnerabilis, starting from mitral regurgitation, aortic regurgitation, myocardial, problems. All sorts of things are found in. And Adonis, please remember that after giving Adonis, you can improve the ejection fraction of the heart. Cactus. Cactus is a very good drug for angina pains, where the nature of the pain will be gradually increasing pain. The pain will not be sudden. It will be gradually. The patient will tell, I'm having constricting pain in the chest. And doctor, gradually, my chest is getting constricted. So gradually increasing anginal pain is covered by cactus. Crataegus is also another very good drug, which is having a lot of pathologies. And laurociosus, where there is a air hunger, just like carbovage. So these are the drugs you can go through. They are required for our cardiac practice. I have mentioned some rubrics from the synthesis repertory. Heart failure, there are a lot of drugs where you can find arsenic, crataegus, then elapse, this is a snake remedy, lachesis, glonoin. Glonoin is a very good drug for vasovagal attack. Vasovagal attack, glonoin, where the patient is exposed to a lot of heat or sunstroke. Very good drug. And this thing, just note one thing, this heart failure, this is a main rubric over here. This thing, when it is accompanied by these symptoms, they become very peculiar. When it is accompanied by other symptoms or other pathology, that itself becomes very peculiar. So heart failure associated with hyperthyroidism, iodine, lycopus, natrum, iod, natrum. So consult the repertory always. Whenever you have the scope, consult the repertory. Heart failure with septicemia over here, carbovage, crotalus horridus, pyrogen. So we are having a lot of, remedies. We are having a lot of references. Only we have to go through the proper, books, proper references. There's another chest heart complaints. This is a summary of the drugs that are coming for the heart complaints, where you can find aurum metallicum, then lithium carbonicum. Lithium is a very good drug. Lobelia, NASA, faintness. Faintness is another feature of cardiac complications. For vasovagal attack, these drugs can come amon carb, carbo, which carbo is good for vasovagal attack. Glonin is very good for vasovagal attack. Ignitia is good. NASA is good for vasovagal attacks. Tabecum. NASA is another drug you can think of in vasovagal attacks where a newlywed wife comes to you. Newlywed wife in an Indian society, when a wife goes to the husband's house and has got a continuous stress with the mother-in-law. The mother-in-law is always, putting the newlywed wife in a stressful condition, and the wife starts having pain in the chest, suddenly falls, suddenly faints down. So these vasovagal attacks where you find a mother-in-law syndrome, think of Naja. There's a very specific drug. I have cured many, newly married women with this drug. Pseudo-vasovagal attack, glonoi, is not a true vasovagal attack. Cardiac arrest, aconite, antimtert, many drugs are there, cratagus, lorocerasus, lobelia, lycopus, a lot of drugs are there. Just you can go through them. Tabecum is also got very good, spongia, strophanthus, and collapse. When the patient collapses with heart complaints, think of digitalis NASA, carbovage, of course, and constricting pain of the heart. I told you that in angina's pain, where the pain is gradually increasing, constricting type of pain, think of cactus. So these are a small summary of how to manage the cardiac cases. So this was my case for today. Thank you very much for your patient hearing. Over to you, Dr. Danish.
Congratulations, Partha Chakraborty, sir. It's really a very good session, and you show the beauty of homeopathy in dying cases. Definitely, we as homeopaths can do a lot of wonders in these kind of cases. But the thing is that you should observe the patient, what you see in front of the patient. This is what you have done. You just observed what is happening with the patient, how the patient is moving, how the patient's hand is moving, how the patient take breathe, and how the patient is having this kind of hiccup, why it is coming, what is the reason, and why he is talking like this. He is not able to talk in the proper way. So that in those conditions, we can think of an hyponatremia. But even without that, your case taking that you are able to reach the right simillimum carbobages. You know that carbobage is such a drug which can do wonders. I have seen in so many cases that kind of wonders shown by the beauty, and I still remember a patient who was recovered from this carbobage, lived up to for 7 years, and they thought that the patient may be dying within 2 to 3 weeks, like that. But we were able to bring the patient back to normal life, and he was able to live up to 7 years. So I was the person who declared him dead also. That is the beauty of homeopathy. And of course, the thing is that you cannot stick upon a single remedy, and you can wait for the long time to get the result. But as and when the symptoms shows some other indication and calling for the other remedy, you will have to change the remedy, and you will have to add some more medicine. That's what you done in this case. That's of course classical homeopathy with pathological prescription. That's what you did it in this case, and you really won the case. And unfortunately, the patient was not at your bedside. That's why we are not able to keep him going some more months or some more years. Anyway, it's a time for discussion. I invite all of you for that. Dr. Beatrice is ready. Okay, you can begin the session.
Yes, thank you very much. Thank you very much, Dr. Partha. It was really, really impressive. And also to see the patient, how bad he was, and now recovering, and many congratulations. And I also would say, like Dr. Danish, you give the glory for homeopathy. It was very impressive. And I would like to ask 2 questions, please. First question is, when you started First, thank you very much for the hint with Adonis vernalis. I did not know that remedy. Thank you very much. When you did start with carbo vegetabilis, low dose, it was every day, once, twice, 3 times. How was it?
Probably it was hourly, on an hourly basis.
Okay,
Yeah, in
often,
this case,
often.
3 to 4 times, at least 3 to 4 times in a day.
Mhm,
Three,
mhm.
I repeat, 3 to 4 times minimum in a day,
Yes,
repeatedly.
yes, I understand. In the beginning, every hour, and then 4 or
Yeah,
5
every
times a day.
4 hours interval.
Yes, thank you very much. And my second question is, when you did start with Arsenicum album, he came back with restlessness, cramping pain in abdomen, numbness of hands. You started with Arsenicum album. In that moment, the patient also had this kind of restlessness.
Restlessness was not so marked, but the shortness of breath was very important in that case.
Yes.
So it was an acute cardiac failure case. So I tried to
Mhm.
restrict myself within those drugs, carbohydrate, arsenic. So I gave arsenic
Ah,
because shortness of breath.
yes. Thank you so much. Because sometimes I see symptoms of arsenicum, and arsenicum is working. It does not have so big restlessness. So that's also in your case. Thank you
Yes,
very
yes.
much for that information. Thank you.
Yes, if anyone want to have a question or want to talk to Dr. Partha Chakraborty sir, you can raise your hand. And now I invite Dr. Ajendra Aristor sir. Do you want to speak? Please unmute yourself if you want to speak. No. No, she's not responding. Now it's a time for Dr. Bob Lim to come out. The Malaysian friend.
Yes.
Yes, Dr. Bob?
Yeah.
We
Yeah.
can't see.
Welcome, Professor Dr. Partha. Can you hear me?
Yes, yes.
Am I audible?
Yes, everything. Fine.
Follow. I was following your case taking. I found that other than you giving this carbo wedge for the patient who has weaknesses on the part of the body or hemiparesis, I also noticed that you have also given this mother tincture of Adonis. So how does it help in your cases? And how long do you continue to give this mother tincture of Adonis?
For hemiparesis.
Over to you, Dr. Partha.
Yeah, for hemiparesis.
No, in this case,
Yeah.
Adonis was given for the cardiac complications. For the hemiparesis, arnica was given actually. Arnica was the main drug based on the hemiparesis and the brain stroke symptoms, the cortical atrophy, which were actually presented in the form of confusion, delusion, the numbness of the hand, right side of the hand. They were covered by arnica, and Adonis was actually given just to keep the heart working properly because the heart was in a very very dilapidated state, very bad condition.
So what is the how long do you what is the protocol? How long do you keep on giving Anika, and what is the potency you have given? Is very low potency, is it? 3
Arnica
and
3.
6.
Arnica 3.
3. Oh. But we in my country we don't have Anika 3. Will cans
You have to come over here
6C
to India.
be used?
You come to India to take the medicines. You will
Okay.
get over here in India. Arnica 3, arsenic 3, Nux 3, we are getting.
Okay. Coming back to that, I was mentioning about this Adonis. How does it help in your treatment? Adonis. I see that you have given certain medicines like carbo wedge, and at the same time you give Adonis. So
Yeah,
what
what is
is
the
the reason for giving adonis together?
Adonis? I told you that it is just a supportive medicine. Mother tinctures are given just to support the constitutional medicine.
Yes.
Adonis was given on that pathology just to support the cardiac condition, so that
So
the
how
ejection
long
fraction can. It was continued. It was
So
continued all along. And the
can we give
dose was
sorry
30
can we
drops BD. 30 drops BD. I normally give 30 drops BD. Adonis burners.
Yes,
okay
hope that your confusion is over by now. And now I invite Dr. Sandeep Sairal to have a chat with the doctor. Yes, please unmute yourself. Okay, you can speak.
गुड इवनिंग सर।
Yeah.
सर मुझे सबसे अच्छा आई लाइक मोस्ट दैट यू वीडियो रिकॉर्डिंग्स ऑफ द पेशेंट वाज द बेस्ट थिंग। वीडियो रिकॉर्डिंग ऑफ द पेशेंट वाज द बेस्ट थिंग।
It is very difficult actually.
यस
कभी-कभी
Yes.
मतलब चोरी छुप के करना पड़ता है.
दिस पार्ट ना
Everything-
एवरीवन शुड डू लाइक दिस इज समथिंग वी लर्न
But
फ्रॉम।
that's a very risky thing, but I actually try to do this so that I can show it to the students.
यस थैंक यू सर फॉर द केस।
Definitely, evidence-based homeopathy is the need of the hour, because we have to show the world that we can do this kind of cases with our medicine. That's the beauty of keeping all these videos and uploading this thing in this kind of presentations. And not only that, that will boost the confidence of homeopathic students also, because they that will definitely improve their intensity, their desire to know what is happening with homeopathy. They want to study more. They will go more and more into the depth of homeopathy. Definitely, their confidence will be boosted. Hey, what's your opinion on this, Partha sir?
Yeah, actually, these evidence-based things are very important, because nowadays it's a totally different ballgame right now. What we used to learn around 30, 35 years back is an entire different ballgame. Now everything has changed. Test cricket has come to T20 cricket. So our approach, if we cannot show our evidences to the whole world, they would understand. They just believe the papers. See, my SGPT was this, now it's like this. So if you tell them, no, you are better, but your SGPT is high, this thing is high, they won't come to us. So we have to go along with these things. And regarding this video recording, I try to do these things definitely with the permission of the patient. Sometimes the patients do not give permissions. Sometimes I have to, but the patients are good. I am very thankful to the patients. They allow me to. I tell them that actually I teach my students in Malaysia, and they permit me to do that thing.
Yes, exactly. That's what we have to do. Dr. Ramparesh sir, so you can.
Thank you, Ganesh, and congratulations, Dr. Partha Chakraborty sir. Very good presentation. Good presentation, evidence-based presentation. Excellent session. Or cardiac diseases in many kinds of medicine. Very good. Carbo-veg is a good remedy. Preparation of carbo-veg would remedy just like carriage of oxygen, weakness, etc. Carbo-veg, beautiful describe of the carbo-veg remedy, and arnica. Arnica bhi is the good remedy. Very, very thanks, sir. Again, presentation.
Yes, exactly.
IFPH. IFPH. Thank you, sir. Thank you.
Yeah. Yes.
Pathological cases. There are three angles of treatment: subjective angle, mathematical angle, and pathological angle. Pathological angle is the very difficult treatment. A structural change the system. So pathological angle always take the lower potency medicine, just like arnica 3, carbamate 6, you, it is very, very thanks, sir. Very.
Not only that, sir has chosen the right remedy at the right time, because shifting to arnica is a turning point once again, because there sir has noted the changes in the brain as well as the other organs also. That's the reason why just went up to arnica 3 from carbamate. That's the beauty of the change. This is where one has to utilize the brain and what to do next. That's what I was analyzing the case from the very beginning itself. Am I right, sir?
Yeah, correct.
Yes. So we have to wind up the session. So I invite once again Dr. Boblin to say what a thank to the session also. Yes, auto thanks. Dr. Bob, please unmute yourself. Yes.
On behalf of the IFPH, I would like to say that Dr. Partha Chakraborty presentation today is brilliant. And the approach in case taking is really wonderful, and we all can follow his methodology step by step, and also the observation of the patient, like Dr. Danesh said. And once again, on behalf of the IFPH, I would like to say a very big thank you to Dr. Partha Chakraborty for sharing his experience tonight,
Thank you,
especially
thank you.
how to bring the from the
Wow.
death of the
Thank
baby
you.
to life again. Thank you very much again, Dr. Partha. I hope that you will share more in the near future. So hope to see you again. Thank you very much. Over to you, Dr. Danesh.
Yes. Sir, you want to say anything more?
Case presentation, super.
Okay. With that, we come to the end of the day, 1405. We have an excellent session tonight. We are very happy and we are thankful to all the participants joining in right time and having chat with our Professor Partha Chakraborty sir. And thank you once again, Dr. Partha Chakraborty. With that, we come to the day. Thank you all. Good night. It's over to Dr. Shaila to moderate the Malayalam session.
Thank you.